So hi friends, welcome to Pharmagrid. So we'll continue with the pharmacy exam MCQs. So first question, calcium channel blockers can have all of the following characteristics except. Options are they block the slow inward current carried by calcium during phase 2 of the cardiac action potential. They dilate peripheral arterioles and reduce total peripheral resistance. They constrict coronary arteries and arterioles and decrease oxygen delivery to the myocardium. They are useful in treating vasospastic angina. Adverse effects include bradycardia and edema. So out of these options, we need to find out the exception. So here the answer is option C. So by blocking the influx of calcium into vascular smooth muscle via L-type channels, these agents, that is calcium channel blockers, decrease rather than increase the contractile response of various arterial beds. The termination of heparin activity by protamine sulfate is the result of. Options are a chelating action, the inhibition of gastrointestinal absorption of heparin, the displacement of heparin plasma protein binding, an acid-base interaction, the prothrombin-like activity of protamine. So here the correct answer is option D, that is an acid-base interaction. Heparin is a highly acidic mucopolysaccharide, whereas protamine is a highly basic protein. When administered after heparin, protamine chemically combines with it, presumably by an acid-base interaction, and inactivates its anticoagulant effect. Hence, it is an effective antidote for heparin. Caution must be employed when using protamine because an excess of protamine can cause an anticoagulant effect. Which of the following agents is composed of a steroid nucleus, unsaturated lactone, and saccharide units? Options are nifedipine, digoxin, flecainide, cholestyramine, warfarin. So here the correct answer is option B, that is digoxin, which is a cardiac glycoside. This digoxin is composed of a steroid nucleus, unsaturated lactone. So here you can see the steroid nucleus. Then this is the unsaturated lactone ring and the three sugars attached via glycosidic bond. Digoxin may be useful in treating one of the following conditions. Options are AV block, torsade de pointes, congestive heart failure, ventricular tachycardia, bradycardia. Correct answer is option C, that is congestive heart failure. Low doses of digoxin activate the vagal reflex to cause AV block and bradycardia, and this action can be beneficial in preventing atrial fibrillations from causing ventricular tachycardias. But the more common use of cardiac glycosides is to increase cardiac contractility in heart failure. Which of the following antiarrhythmic agents is most likely to cause pulmonary fibrosis during therapy? Options are procainamide, sotalol, amiodarone, lidocaine, quinidine. Here, the correct answer is option C, that is amiodarone. Of all the drugs on the list, amiodarone is most likely to cause life-threatening pulmonary fibrosis.